Hello everybody. Today we'll be talking about interstitial lung diseases, commonly known as ILD. ILD is basically a title given to the bunch of pulmonary illnesses, bunch of respiratory illnesses pertaining to lungs. When we think of interstitial lung disease, it simply means it is a progressive, let me repeat it is a progressive degenerative and autoimmune disease of lung destruction. Is it always autoimmune? There are few cases where autoimmunity may not be very pronounced, but in most cases it is genetic and it is autoimmune. Usually, all kind of interstitial lung diseases are triggered by inhaling some kind of chemicals like asbestos, maybe like cotton fragments, maybe due to smoking. These are the very, very common triggers, but these are not the causes. Let me repeat it again. People label these as the causes of interstitial lung disease. Let me tell you, they are actually grossly mistaken. It is basically a inner sensitivity which is creating a precondition which is triggered by these external agents leading to this kind of hyperresponse. Among most common kind of interstitial lung disease, the first is the hypersensitivity pulmonary fibrosis. Second common is sarcoidosis. Third common is asbestosis. And the fourth one is hypersensitivity pneumonitis. So if you look at even the names and the characters of the diseases, they are having the strong genetic autoimmune component. What is the prognosis of these interstitial lung diseases? The usual prognosis of interstitial lung diseases is that they can be controlled till a limit. They can be controlled, and that control is possible till just a limit. Beyond that, they are progressive and they create more and more damage. Most of them respond to the inhalers, the steroids, and also they respond to some kind of nebulizations and the extra oxygen therapy. But today I'm going to talk about something different. Today I'm going to talk about a different kind of a treatment for these kind of diseases, all kind of interstitial lung diseases, or even lung diseases, or even all kind of genetic and autoimmune diseases. And what I'll be talking about is what I have just done today with a patient who was actually breathing heavy. So let me tell you about this patient. This patient is from out of Nagpur. He's from Hyderabad. He came to Nagpur for an event. When he came to Nagpur for an event, he was here for 3-4 days. We were in talks with this patient. Actually, he's very close to me and very well known to me. So we were in talks with about treating this patient since quite long, maybe probably 6 to 8 months. But the treatment was not able to start because of some other reasons. They came to Nagpur for an event. They attended the event. For 4-5 days, he was okay. But then the breathlessness started increasing. He was a known case of interstitial lung disease. So breathlessness started to increase, and then he started to get almost respiratory distress, and he was hospitalized in ICCU. There he was investigated. The MRI was done. The sonography was done, ultrasonography, and all other investigation. Right from all the inflammatory markers were done. He was investigated in details, and again the stamp was given. It's a confirmed case of interstitial lung disease with lung fibrosis eventually starting, progressive lung fibrosis. So after all the investigation, finally they got the same report what they knew 6 months back. Doctors told this is interstitial lung disease and there is no treatment and it is going to be progressive. They have given all the antibiotics, nebulizers, and finally the steroids inhalers, which were again not helping. So they got discharged on 6th day with almost hardly 10% result. They said, actually I'm still breathless. They walked to my clinic and he was breathless. The breathlessness is obvious on his face with the beads of the sweat. He was exhausted, he was breathless. Then we started our treatment, our case study, and he joined our treatment. He joined our advanced genetic based treatment. As he joined, we went for the study, we went for a detailed study, and this detailed study went for approximately 2.5 to 3 hours. After 3 hours, we selected the medicine, gave the medicine, and started our activity. So till now, you must be knowing about what we do. We do mind reprogramming and genetic realignment or reprogramming. So while taking the case history, we came to know about some causes which I cannot reveal here, but the causes were at the emotional and mind level. So I cannot reveal because he is very close to me, he is very known to me, and he will be watching this live anyway. So we don't reveal the identities of the patient. So what we thought was that the past holds the clue for all your present miseries. Let me repeat again. Past holds the clue for all your present memories. Not past life, your past from this life. It holds the clue for all your present memories. We studied his past and exactly were able to find out the causes which have led to this kind of a problem. There was smoking as a trigger, but the mind and the inner structure, the weakness in the inner structure was the primary fundamental cause, and the smoking was a trigger cause or the exciting cause. Smoking was stopped for a long time, got long back, so it was not the issue now. So when we processed with the activity, we did all the work, whatever we do on the past triggers, the present triggers, and the smoking triggers. Whatever we can do, we worked on the mind and worked on the past memories. And after 1 to 1.5 hours, we asked, how are you feeling? He said, I am okay, slightly better. See, interstitial lung disease, who was on oxygen for 5 days, feeling better in just 1 to 1.5 hour of activity was actually good. But we are in the habit of not getting satisfied by good. I said, no, this is not possible. Check it out. So he checked some, he walked up and down the stairs. He still felt breathless. I said, we'll do it again. See, at our center, we are the team of almost 12 doctors, out of which my team does wonderful activities. But we are in the habit of repeating activity if needed. So we decided to repeat the activity. And when the activity was repeated, after that we asked again, how you feel now? He said, I am feeling much better. But we were not convinced. We want proof. We are not interested in how he is feeling mentally, because mental feeling can change just in minutes. So we don't deal with the mental feeling change. We deal with the concrete results. So we asked him to walk up and down the stairs, and then he walked outside on the roads, and then he came back and said, I am much better. Earlier, before, when I just came here, I was not able to walk from the road to your clinic. It is just on the same floor. It is not even the first floor or a basement. It's just ground floor. But he was breathless. Now he was walking 2, 3, 4, 5 times, and he was absolutely well. Now this is how we actually change the pathology, by actually working on neurobiology and psychology. A completely unique concept, a completely different concept, but this concept has given us a power to understand the cells, understand the cellular physiology, cellular pathology. So we enter inside the cell, find the cause, find the problem, and actually we do minor tweaks inside your cells. Just imagine if we can do these minor tweaks inside your cell, what a power we are having in our own hands. And trust me guys, we are experiencing this power daily, and we are able to give benefit to all kind of incurable and absolutely critical, hopeless diseases. It is so fulfilling. It is so satisfying. Today I was talking to one lady. who is herself working in medical tourism. And amazingly, we worked out if this is the magic results coming just in one day, why not plan a 5-day retreat for patients, for people to reset their mind? See, we reset our mobiles, we reset our computers, we actually reboot it again and again to get a completely new computer, to get a refreshed and automated brand new computer or mobile by just rebooting it, isn't it? So when we reboot, when we can reboot computers, when we can reboot mobile, how awesome it will be if we can completely reboot ourselves. Amazing, right? So we decided to take the retreats. We have taken retreats in Mumbai earlier. Our latest retreat is planned in Bali. Maybe you may be interested in Bali, so you can write in the comment if you are interested in Bali. And I will be also giving the link of registration for free consultation if anybody is interested. And please share this video to as many people as possible, because people all over the world are looking for some kind of a relief, some kind of a solutions. See, there are so many incurable diseases in the world, and there are so many people who have lost all the hopes. If your sharing can contribute to somebody's hope, probably this is the best job which will be done by you from your end. So please share this video to as many people as possible. And if you are watching this on YouTube, please subscribe the channel and also press the bell icon so that you get these amazing videos. We are doing this daily. See, this is not the first time I am doing. Today itself I showed one of the videos to one of my friends. In just 40 minutes, the breast cancer tumor was gone. I know you won't believe. I know most of you. Is it really possible? Yes, it is really possible. We are not deliberately not posted that video on the YouTube, but we will be posting it after masking the face. So you can just listen to the patient's live interview, how in just 30-40 minutes, the breast cancer tumor was just gone. So I'll be posting it. So we are doing this kind of incredible result giving activities almost daily. It is a regular feature now. So I want you to spread this message to as many people as possible so that people get the live results. Now this patient was of interstitial lung disease, autoimmune and a genetically determined disease triggered by smoking, but the inner system needs a reboot, inner system needs a change. And once you change the inner system, once you change the cellular physiology, once you change the cellular pathology, once you change the pulmonary physiology, lung functioning, whatever problem you're having, they are going to start reversing immediately. And this was the magical result of reversal of the disease in this case. And patient was very happy. Patient was all the smiles, and I felt a lot more satisfied. So thank you. Those whoso is actually joined with us, I like to thank for trusting us for your incurable problem. I know you had so many questions. I know you had so many doubts earlier, but I also know there was no solution just in front of you. We provided the solution. You trusted us, and I'm sure wherever there is 0% chances, our results are 80 to 90%. Let me repeat it. Where there are 0% chances of reversal, our results are as good as 80 to 90% in absolutely incurable and critical and hopeless diseases. The quality of life which we are improving in just minutes is probably the best gift one can give to his ailing parents or relatives or friends. So let us work together to reverse the diseases and improve the quality of life to as best as possible. And let us spread this message to maximum group, as many groups as possible. Thank you, my dear friends. Thank you for being here. Thank you for sharing in advance. We'll be meeting tomorrow, 9 p.m. again with a new case, new interesting story, and a new Facebook live. Thank you. Bye bye. Take care and stay healthy.